My name is Felix Mutua. I head the Department of Clinical Medicine and Surgery, which falls under Faculty of Clinical Sciences. Department of Clinical Medicine has higher national diplomas, a diploma in clinical medicine and surgery. We also have a certificate course in emergency medical technician, which falls under the department, and also short courses. We have higher national diplomas, which take 24 months, 18 months in class and practical site, then 6 months in mentorship, which is we assign students together with the Clinical Officers Council. And to qualify to do higher national diploma, you need to have a valid practicing license from the Clinical Officers Council and a 2-year experience. The mode of study is blended. We do face-to-face, we do e-learning, and we also have virtual classes. One of the higher national diploma is anesthesia, and the specialists here work in theater. In theater, they assist to do procedures, surgical procedures. Ear, nose, throat, head and neck surgery. The specialists here treat conditions in the ear, the nose, and in the throat, and around the neck and the head. They also do surgical procedures of the head, the neck, throat, and ear. Nephrology deals with kidney diseases, treatment of kidney diseases, dialysis, and also the diagnosis of kidney diseases. Speech and language pathology, they deal with people who have issues to do with the speech, maybe the difficulties in speech, and they also diagnose and treat the speech pathologies. Family health deals with communities, families, and the hospital setup, where we have issues to do with the community, issues to do with the family, and also they do treatment in the hospital and also in the community as a whole. Ophthalmology and cataract surgery, these are specialists in the eye. They do eye operations and treatment of eye conditions. Ophthalmology, advanced refraction, low vision, they deal with the sight. Those people who have problems in seeing, so they can be able to correct their sight, maybe by use of spectacles. Orthopedic and trauma surgery, these diagnose issues to do with the bone diseases and bone treatment and operations. Reproductive health deal with maternal diseases, maternal conditions, and also do with emergency operations, maternal operations. Pediatrics and child health, they deal with the children diseases and the treatment of children conditions. Mental health and psychiatry deal with mental diseases and mental conditions, treatment of mental conditions. Addictive sciences deals with drug, alcohol, and substance abuse. Chest medicine deals with chest conditions, including tuberculosis. Dermatology and venereology deals with skin diseases and also sexually transmitted infections, including HIV. Audiology and hearing care technology deals with advanced technology in hearing. Emergency and critical care medicine deal with emergencies in the casualty, running of the ambulances, and also ICU. Oncology and palliative care deals with cancers, cancer treatment, and diagnosis. Diploma in clinical medicine and surgery takes 3 years. For you to qualify, you need to have mandatory clusters that involves English, C plain in English or Kiswahili, C plain in biology, and a C minus in chemistry. And you also need to have one additional subject, which is mathematics, a C minus, or physics, C minus. A clinical officer takes 3 years in training for the diploma course, then proceeds for 1 year mandatory internship, which you work under supervision. From there, you are registered by the Clinical Officers Council, and you will be able to work in hospitals, the referral hospitals, the primary hospitals, and your work is to diagnose, to treat medical conditions or surgical conditions, and also to rehabilitate and also to prevent infections. The clinical officers will work in the primary care center, that is the Odhi Center, in the county hospitals, sub-county hospitals, referral hospitals, even in other corporate bodies. Once you have done the diploma in clinical medicine, KMTC provides higher national diplomas. You can upgrade to higher national diplomas, which we have around about 18 of them in Kenya Medical Training College. And once you have done that, you can move to the universities and do a bachelor's degree in clinical medicine and surgery. You can also do masters in clinical medicine and also do PhD in clinical medicine. You can work in Kenya and outside the country. Our department also has a certificate course in emergency medical technician, which takes 1 year. And the qualification is a C-. And the work of the emergency medical technicians is to work in disasters, to work in pre-hospital care in ambulances. The department runs a short course in regional anesthesia and acute pain management, which targets people with higher national diploma in anesthesia. The clinical officers subspecialize in regional anesthesia and acute pain management, and their work is to treat acute pain and also to give regional anesthesia. Duration of the training is 6 months. The mode of study is face-to-face and e-learning. Currently, we have 41 campuses training diploma in clinical medicine, which are widespread in the country. The setup of our campuses is that they are built where the hospitals are, within the hospital environment. So our students are able to train physically in class and to attend clinical sessions in the nearby hospital. Being a government institution, we are able to access all the government institutions and even private institutions. We have graduates working in all these hospitals, so the reception of our candidates, of our students, is very good. So we call for applications for interested candidates, interested students, which is done online. Can we visit our website and seek for the advertisement and apply? We select and post students in March every year for diploma in clinical medicine. And for higher diploma, in every September, we admit students in higher diploma programs.
My name is Grace Karani. I'm a third-year student, Department of Clinical Medicine, Nairobi campus. I'm pursuing a diploma in clinical medicine and surgery. As a clinical medicine student, when I graduate, I become a clinical officer. So what I entail to do is I clerk patient, that is, take history from them, I examine them, make a diagnosis, and then I follow up my patients after I treat them, either in the clinic or outside the clinic, and I deal with them even at the community level. My learning experience here at the Kenya Medical Training College has been amazing for the 3 years, almost 3 complete years. So learning mostly entails, we have the theory classes, we have lessons, we have our practical training at various institutions, our very best institution being here at Kenyatta National Hospital, where we are exposed to different and variety of conditions. We have many amenities in our school. An example of where we are standing, this is our skills lab, where we have everything simulated. So whatever cases we find at the hospital, we have them here. So you have time to come here and train even after you've gone to your practical sessions. I will definitely recommend others to join the journey here at KMTC for various reasons, and most especially it's because of the passion that our lecturers have at this institution. Here you get an opportunity to study, not only as a student. Here you feel yourself as part of the team. You are welcomed to be part of the medical team. You're given an opportunity to study, an opportunity to explore other departments as well. So you're not only put in your department, but you get a chance to experience what other departments do. Because at the end of it all, once we leave here, we not only work as clinicians, we have other faculties to work with. So you leave here knowing what the radiographer does, you know what the nurses do, so you have a whole competent picture for you to explore. Applying to KMTC is a very simple procedure because we do it online. So what you do, you log onto our portal at www.kmtc. When you get there, you have the requirements, you have the details and the application procedure. So it is very entailed. So for my course, clinical medicine and surgery, all you need is a mean grade of a C, and then you have C- in chemistry, biology, mathematics, and physics.